Good day, class. I hope you're good. I'm also fantastic. So today we're continuing with our endocrine system topic, but today we're doing the disorders. So we're going through different disorders, right, in different glands, right. So we'll be looking at those disorders. Right, let's just get into it without wasting time. Okay, so let's look at the endocrine system disorder. Right? Look at the disorders. So endocrine glands can either secrete too little or um, too much of their secretions, which are your hormones, right? So when they're secreting too little, we say that that's hypo secretion, too little, hypo. Right? There's an O there. But when they're secreting too much of the hormone, we're saying that they are hyper secreting, right? Which is called hypersecretion. Okay. Hyper means more, hypo means little, right? Less. Okay, now let's get into the disorders of the pituitary gland. Disorders. Okay. So the first hormone that we'll focus on that's secreted by the pituitary gland is the growth hormone, right? So remember, what's the function? We said that the function of the growth hormone is responsible for growth in with regards to the skeletal muscles, right? So they allow you to grow. So what happens when you when your body secretes the growth hormone more? In a case of hypersecretion of growth hormone, what happens? So there's a disorder that's caused by the secretion, by the hypersecretion, which is, remember, hyper means more, right? There's a disorder that's caused by hypersecretion of the growth hormone after puberty, and that disorder is called acromegaly, right? So that's the first disorder. So let's just look at it. How does it look like, right? Okay, so this is acromegaly. So this is a normal person without acromegaly, and uh, the other picture is a picture of a person who has acromegaly, right? So can you see with the person has a thickened frontal bone here, right? And also the protruding glabella. So here, just in between, right? Your eyes here, right? It's protruding, so it means that it's prominent, so it's bigger, right? So can you see that the nose are enlarged as compared to the person who does not have acromegaly, right? So the nose are enlarged, right? And also the lip is enlarged also. So you just have to compare, right, the features of the person who has acromegaly as compared to the person who does not have acromegaly. Okay, so the lip is enlarged, and also the jaw, right, is protruding. So the jaw is prominent, right? See, we say that the jaw is prognathous, right? So the jaw is prognathous. We'll do prognathous when we get to evolution. So it means the jaw is a bit bigger, right? So it's enlarged. The jaw is enlarged. Okay. Okay. What are the symptoms? As we went through the symptoms of acromegaly, but let's just recite them again. So the first symptom of acromegaly is enlargement of hands and feet, right? Another symptom is that there's an enlargement of the forehead, jaw, and nose. Okay, so we're done with acromegaly. Remember, acromegaly is caused when your pituitary gland secretes more or a lot of growth hormone after puberty, right? After puberty. That's when you have acromegaly. Okay, let's go to the second disorder. So a second disorder is dwarfism. Dwarfism. So dwarfism is caused by the hyposecretion of the growth hormone during childhood. Remember, so this one is when you have less growth hormone in your body during childhood. So it means that your pituitary gland is not secreting a lot of growth hormone. It's under secreting the growth hormone, right? So what causes dwarfism? So dwarfism is caused by the lack of the growth hormone during childhood, right? So someone who's a dwarf, someone who does not grow, right? So they're short. Can you see the picture here? So this person, this person is not even a child, right? This is an old person, but because there was an undersecretion or a hyposecretion of the growth hormone during childhood, so they were not able to grow. Remember, the growth hormone goes to your skeletal muscles so that it helps you to grow. But this person didn't grow because they did not have much growth hormone in their circulating in their body and going to their skeletal muscle. Okay. So what are the symptoms? Let's look at the symptoms of dwarfism. So the symptoms are short stature, right? As you can see, the person in the above picture, the person has a short stature, right? And also the second symptom is slow growth and delayed puberty. So your puberty delayed. So you have your puberty late, right? And also you grow slower because the growth hormone, it helps you to grow, right? But now because you don't have it, you grow slower because your body is under secreting, right? That growth hormone. Okay. Now let's look at in the case whereby the your body secretes more growth hormone during childhood, right? It causes a disorder called gigantism or giantism. It's either you can say gigantism or giantism, right? So giantism or gigantism is caused by the hypersecretion of growth hormone during childhood. So when the growth hormone is hypersecreted by the pituitary gland during childhood, it causes what? Gigantism, right? So giants, those people, most of the people in those who play basketball, most of them they have an over secretion of they had an over secretion of growth hormone during their childhood, right? So this is a person, right, standing in front of a normal person. This is a person who has giantism or gigantism because they had an over secretion of growth hormone during childhood, right? Okay, so this is a picture of a person who's a giant. Okay, what are symptoms of gigantism or giantism? So obviously long bones, you you tend to have long bones, hence they are so tall. And the second symptom rather, the heart and other organs they enlarge, causing high blood pressure. Obviously, when your heart and other organs enlarge, remember the heart is responsible for pumping blood to each and every organ in your body, right? And when your heart is larger, it causes a high blood pressure, right? Does that make sense? Okay. And we'll get to the what does high blood pressure mean, right? So what does it mean? Let me just explain it now. So high blood pressure means that the blood, the force against the walls, right? So the force against the walls of your artery, right? So if the force of the blood against the walls of your arteries is more, we say that you have a high blood pressure. But if it's less, if the force against the walls of your arteries is less, right, we say that you have a low blood pressure, right? Hence, high blood pressure can lead to a rupture, right? Can lead to a rupture of arteries. Right? So I hope that's clear. Okay, now let's go to thyroid gland disorder. Thyroid gland disorder. So when the thyroxine, remember, let me just go back. Thyroid gland. What are the secretions of the thyroid gland? Remember, the thyroid gland is responsible for secreting thyroxine. that's responsible for secreting thyroxine. I hope that makes a lot of sense, right? Okay. So when the thyroid gland secretes more thyroxine, we call that hyperthyroidism. So it means that it secretes more thyroxine. So we call it hyperthyroidism. So what are disorders that are caused by hyperthyroidism? So the first disease we have is Graves' disease. So it's caused by an oversecretion of thyroxine, right? So this is caused what causes this disease? It's an immuno uh, deficiency disease, right? Not an immunodeficiency disease. Let me just say that again. So it's caused by the immune system attacking your thyroid gland, causing it to overproduce thyroxine. So your immune system, right, it attacks your thyroid gland, right? And after attacking the thyroid gland, it causes the thyroid gland to overproduce thyroxine. And remember, what's the function of the thyroxine? Function of the thyroxine is metabolism, right? What's metabolism? Metabolism is the rate at which your body breaks down food, right? And if there's an overproduction of thyroxine, it's going to lead to a different, a variety of symptoms, right? So the first disease that's caused by hypothyroidism is Graves' disease. Okay. Okay. Now let's look at a person who has the disease. Can you see the person has bulging eyes, right? And also the eyelids they retract means that they go backwards, right? And also your eyes they become red, right? Your sclera. See the person's sclera is reddish. So the redness in your sclera, in the person's sclera. Okay, this is a picture of a person who has Graves' disease. What are the symptoms? Right, bulging eyes. Right, so the person will have bulging eyes. Number two, weight loss. Obviously, you know weight loss. If we have an overproduction of if you have an overproduction of thyroxine, right, it means that your body will break down food faster. As a result, you lose weight because what is it caused by? So losing weight is caused by fast metabolism. So it means that your body is breaking down food at a faster rate, right? It's breaking down food at a faster rate, which causes you to lose a lot of weight because now it breaks down food, it breaks down carbohydrates. After breaking down glucose, right? After breaking down glucose, let me just say glucose. After breaking down glucose, it attacks the fat, right? In order to release energy, because now it's breaking down the glucose as quick as possible. After breaking down glucose, it goes to fat and breaks down the fat in order to release energy. Hence, the people who have Graves' disease end up losing weight because they have fast metabolism, meaning that their bodies it breaks down food at a quicker rate. Okay, let's go to the second uh, disease that's caused or disorder that's caused by hyperthyroidism. Remember, hyperthyroidism is an over secretion of the hormone thyroxine. Okay, so goiter. So number two is goiter. So goiter is caused by an elevated thyroid activity. So again, it's when your thyroid gland is secreting more thyroxine. Okay, let's look at a person who has goiter. Right? Can you see? This is the thyroid gland of a person who's just normal, who does not have goiter. And on the other side, we have a person who has goiter, and you see that his or her thyroid gland is enlarged. Right? So there's an enlargement of the thyroid gland, right? An enlargement of the thyroid gland. Okay, so this is actually the symptom of goiter. So how do you see a person who has goiter? You see them by an enlarged thyroid gland. So the thyroid gland is enlarged because it's secreting more thyroxine, right? Okay. Now let's go to hyposecretion. Remember, we're focusing on disorders that are caused by hypersecretion. But now, what happens when your body undersecretes, right, or secretes less um, thyroxine, right? And we call that hyposecretion or hypothyroidism, right? So, what are disorders? Like, let's name the disorders that are caused by hypothyroidism. Okay, number one, we have a disorder called cretinism. So cretinism. So cretinism is caused by lack of thyroxine from birth. So if you have a lack of thyroxine from birth, it leads to a disorder called cretinism. Okay, so let's look at people who have this disorder. How do they look like? Right? So can you see that this person, it's unlike dwarfism, right? So this is a person who has cretinism. Okay, now let's look at the symptoms and see what's the difference between this um, this disorder and dwarfism. It's not dwarfism, right? Even though they may be similar, but it's not dwarfism in some ways. It's similar in some ways, right? Because the person is growing very slower or slowly, right? Person is growing slowly. So the symptoms of this disorder is physical and mental slowness, right? So it means that, remember, metabolism is responsible for releasing energy to all cells in your body, right? And we have cells in each and every part of your body. And if those cells, right, are not receiving a lot of, or enough, let me just say enough, if those cells are not receiving enough, right, thyroxine, it means that their metabolic activity will be slow. And if the metabolic activity is slow, it will lead to physical and mental slowness. Hence, this person, right, look at the person's stature, right? The person is just growing slowly. And also, there's mental slowness, right? Because the thyroxine is also responsible for mental health. It's also responsible for mental health. And if you don't have enough thyroxine from birth, it means that your mental activity will be slow and also your physical, including your physical activity. Okay, let's go to number two. Number two, our second disease, right, or disorder that's caused by hypothyroidism is called myxoedema, right? Myxoedema. It's caused by an under secretion of thyroxine. Right? So it's caused by an underactive thyroid gland in adulthood. So when you're in adult now, but you have an under secretion or an underactive thyroid gland, what happens when you have an under secretion, right? So can you see a person who has myxoedema, right? Look at the feet, right? And look at also the texture of the skin, right? So let's look at the symptoms. Obviously, we have mental and physical tiredness. Remember, we said that thyroxine affects mental healthness, right? Mental health, and also it affects physical health, right? So the person, right, will experience mental and physical tiredness, right? And also they'll have a low metabolic rate because thyroxine is responsible for metabolism. Remember, what is metabolism? The rate at which your body breaks down food. Okay, and also roughening of the skin. As you can see, with this person's skin is a bit rough. So roughening of the skin, right? And also just to add another symptom with the person's skin is a bit swollen, right? It's a bit swollen. The skin is swollen. Okay. Now let's go to pancreas disorders, mainly diabetes. So what is diabetes? Diabetes mellitus is a disease associated with high blood glucose, right? So it is caused by high blood glucose or high sugar levels. Does that make sense? Okay, now let's look at the symptoms of diabetes mellitus. The symptom is a damage to all blood vessels. That's the first symptom. Second symptom is circulatory problems. Right? Third symptom is multiple organ damage. Right? And the fifth symptom is wounds in the skin do not heal well. So these are the symptoms of diabetes mellitus. But there are two types of diabetes, right? We have type 1 diabetes and type 2 diabetes. Okay, let's look at type 1 diabetes. So type 1 diabetes is it's a diabetes whereby the pancreas does not produce the hormone insulin. So it's not producing the hormone insulin, right? So if your body fails to produce insulin, it leads to type 1 diabetes. It's the most severe, right? And what's the treatment of type 1 diabetes? So the treatment is insulin injection. So you have to go to the hospital to be injected with insulin because your body cannot produce insulin, right? And remember, what's the function of insulin? Function of insulin is to bring down sugar levels, right? By stimulating the conversion of glucose to glycogen. So if you don't have insulin in your body, it means that your sugar levels will always be high, right? And for you to deal with those high sugar levels, you need to go to the hospital to get insulin, to be injected with insulin. And we got to the process of how insulin is made through genetic engineering or genetic modification and genetics, right? So we did that whole process on how it is produced. Okay. Okay. So this is diabetes type 1. So can you see the body? So this is the pancreas, right? So the pancreas obviously is responsible for secreting glucagon and insulin, which are responsible for sugar levels or glucose levels in the blood, right? So when you have type 1 diabetes, means that there is no, right? There is no secretion of insulin. There's lack of secretion of insulin. As a result, the insulin levels or glucose levels in the blood, they're not maintained, right? They're not regulated. Okay. So this is just a picture. So this is a picture of a normal person who does not have diabetes, right? So they have enough insulin. The insulin gets into the cell, right? And those that insulin deals with the glucose level, right? Whereas a person who has type 1 diabetes, they don't have insulin. Their pancreas is not producing any insulin, right? So there's no insulin to deal with glucose levels. Okay, we'll get to type 2 diabetes. So now let's get to type 2 diabetes, right? So the type 2 diabetes means that the pancreas produces insulin in small amounts. So it produces insulin, but the insulin is small as compared to the glucose in the blood, right? So it means that the insulin cannot deal with the glucose in the blood because it's secreted in small amounts. So that's the difference between type 1 diabetes and type 2. So type 1, it means that the pancreas is secreting no insulin. It does not secrete any insulin. Whereas with type 2 diabetes, it means that the pancreas produces insulin in small amounts. Okay? Okay, what's the treatment? So the treatment is healthy diet, right? You can follow a healthy diet because the body is producing right insulin, but just in small amounts. So it means that you need to eat healthy, avoid food that has a lot of glucose, a lot of sugar, right? Healthy diet, and also, what's the second thing that you can do? You can lose excess weight, right? That can help you to deal with type 2 diabetes. As the final treatment, you can exercise regularly, right? You can try to exercise regularly because when you exercise, your body breaks down the glucose, right? In order for it to release energy, right? So the cells, let me just be specific, the cells will break down food in order to release, or break down the glucose in order to release energy, right? Okay, so let's look at the pictures here. So this is type 2, right? This is type 1. I'm like type 2. Sorry about that, guys. This is type 2 diabetes, right? So this is a person without uh, diabetes. So look at their pancreas. Their pancreas is secreting enough insulin, right, into the bloodstream, right? And that insulin is helping to remove or to lower the levels of glucose in the blood. So look at the glucose that's released by the pancreas. This is a normal person. Whereas when it comes to a person who has type 2 diabetes, they're secreting less. Can you see the difference between a person who does not have diabetes and a person who has diabetes type 2? They're secreting, so the pancreas is secreting less um, insulin. And so that insulin is not removing, right, glucose in the blood effectively. So you end up having a buildup of glucose in the blood, and that's bad, right? That affects the functioning of your blood vessels, because now you have a lot of sugar, you have a lot of glucose that's just stuck in the blood vessels, right? Or that just builds up in the blood vessels. Okay, guys, I think we are done with disorders, right? We are done with disorders. So the next video I'll be releasing is based on thermoregulation, right? Based on thermoregulation. I'm just avoiding making these videos too long, right? So that uh, you can focus effectively. So I'll release the next video, I think tomorrow. That's based on thermoregulation. I just want to attack thermoregulations alone, independently, right? Uh, without confusing you with a lot of information. So yeah, I'll be done, guys, and I'll see you in the next video. Release the next video tomorrow. I hope this was helpful.